Many of our doctors said, yeah, I'm no longer coming to the hospital. And that is the time, at least in our with us, we got us shut down. Everybody got their heads down, their thinking caps on. Government luckily has published some very lovely documents, guidances. So we went through those guidances, we expanded on them, and created our own internal guidance document. March, especially end of March, beginning of April, dark days, everybody is scared. The data coming out of Spain, data coming out of some other Western European countries, doctors dying, patients dying, and these are early days of COVID. I think the first patient came in Pune, and when the cases started trickling in every city, many of our doctors, many of our nurses ran away. Many of our doctors said, yeah, I'm no longer coming to the hospital. And that is the time, at least in our with us, we got us shut down. Everybody got their heads down, their thinking caps on. Government luckily has published some very lovely documents, guidances. So we went through those guidances, we expanded on them, and created our own internal guidance document. I remember at that time PPE was not available. We were the PPEs were all getting imported. They were all landing in this big air hub in Nagpur. We sent nearly half a dozen ambulances, drove them down to Nagpur and picked them up from the airport. At that time, what a PP kit, which is $200 today, time 1,500 bucks, $2,000, right? And we paid that price. We for 100-bed hospital, we bought stuff worth 15 lakh rupees to assure the doctors, look, we are putting the best we can. We are making, and we started, as Dr. Jairam said, intensive training program. The more you train, the less you're afraid. The more you train, the less you're afraid, right? And every patient, of course, going for procedure or going for surgery was treated as COVID positive. Beds were vacant. We had lots of beds. We started actually quarantining patients. Patients coming for surgery, we tell them, okay, you may be COVID positive. And if you undergo the stress of surgery, that might actually, we have screened you, you look to be negative, but may actually be maybe in the window period. So let me quarantine you for 5 days free of charge. You just pay me the bed charge. 5 days stay on bed. If he's free at the 5th day, we take him up for surgery or procedure. We did all of those things. And ultimately, over a period of 2-3 weeks, the doctors became more confident. The fence sitters who are now at home, they started coming back to the hospital. The patients started coming back. That confidence had to be built.